Okay, so let's look at the avoidance behaviours. And avoidance usually involves avoidance of either sounds, words, situations, or people. The problem with avoidance behaviours is that they work very well, insofar as they stop us stammering, and they stop us from experiencing all of the unpleasant experiences of stammering. But there's a side effect of using these avoidance behaviours, and that is that they can actually increase our fear of stammering in the long term. So if we have a particular word that we think that we're going to stammer on, we keep avoiding that word, we're never going to learn how to cope with that word. And also we're never going to actually find out if we really would stammer on it, because we never say it. And again, if we keep avoiding the difficult situations, or situations that we think will be difficult because they've been difficult in the past, we'll never actually find out if they really are still difficult. So the stammer progresses, it changes over time, and we also progress and change over time. Or we would progress and change over time if we didn't avoid situations. If we avoid, then we stop progressing. And if we stop progressing, then we diminish our chances of getting a better degree of control over the stammer. So yes, here I've just written, avoidance prevents new learning, and that could be a major obstacle to recovery. Now, Joseph Sheehan, one of the most well-known speech and language pathologists in the United States, considered all avoidance to be bad. And he came up with a form of therapy, or he advocated what he called avoidance reduction therapy. And a part of that avoidance reduction therapy that he advocated included voluntary stammering. So he would suggest to his clients that they go out and not only do they not avoid stammering, but they actually do it on purpose as a way of overcoming their tendency to avoid. And in fact, very much of the speech therapy that is advocated by speech therapists generally nowadays also involves elements of avoidance reduction. And indeed, voluntary stammering is used to a certain extent. But I would like to ask the question, is avoidance always bad? Or is all avoidance bad? And I would suggest that, in fact, not all avoidance is bad. No. That there is something that you could term intelligent avoidance. And to try and explain what that is, well, I agree that it's good for us to push our comfort zones and to put ourselves out into situations that really do test us. And that very well-known phrase after the book, feel the fear and do it anyway. I think generally that's a good thing, that's good advice, up to a point. But there are limits. And I think if we put ourselves into a situation that is so extreme because we're practicing non-avoidance, that if we put ourselves into a situation that is highly likely to lead to negative or traumatic experiences with our stammering, that's probably not a good thing. The sort of examples of that maybe, for example, we decide that we're going to speak publicly in front of an audience. Maybe might decide to become involved with a play or something like that, or some sort of function that involves public speaking. Although that's a great thing to do, I think one needs to be cautious not to jump into the deep end and then find that you can't swim, because there's nothing worse than finding oneself in the limelight, in everyone's attention.
Way over their head.
And then all of a sudden getting completely and utterly stuck, and watching all of the audience having expressions of, watching their expressions. It can be quite a traumatic experience. So what we need to do really is find a middle way, not to avoid too much, and to be constantly working towards avoiding less and less, but not to go completely wild and throw ourselves into deep water when we can't swim. Okay, so I'm going to talk a little bit more about some of these other secondary symptoms. I said that repetitions and prolongations are secondary symptoms. And this is a slightly different viewpoint to that of many speech therapists and researchers who would say that actually repetitions, prolongations, and also blocks are actually the primary symptoms of stammering, and they often seem to be the ones that emerge first in children and small children. Well, that's one argument. The other argument, though, is that actually repetitions and prolongations are stalling strategies. And so, for example, if we have a word that we're not ready to say for one reason or another, we can always repeat the word before it, and keep saying the word before it until we feel ready to say the word that we expect to have difficulty on. Or we could prolong the word. I mean, one thing that is for sure is that if we can repeat a word over and over, we're probably not having a problem with that word. Probably the problem is further downstream. So, insofar as we use them as stalling strategies, I would argue that they're secondary symptoms and they're not really the central core of the disorder. I would also argue that we do have quite a bit of control over them, so that we could decide not to do repetitions or prolongations anymore, and just to let the silent blocks happen. But repetitions and prolongations do fulfill a useful function. They help to maintain listener attention. So if we keep repeating something, the listener knows that we're still trying to speak. Whereas if we just had the silent blocks, then the listener wouldn't know that we're trying to speak, and we might lose our conversation turn. Something to point out, though, is that repetitions and prolongations, and also fillers, things like and it isn't only stammerers that use these. Everybody uses them. They're completely normal parts of speech. And people usually use them when they're experiencing word-finding difficulties. So you can't remember the word you're trying to say, so you repeat the word before it, or you say and then when you can remember the word, then you say the word you want to say. So I would say that repetitions and prolongations and fillers like and interjections like and actually and whatever other interjections you may use, these are absolutely fine. There's nothing wrong with using them.
I tend to I should start up again. I tend to use the word actually and basically quite a lot. In fact, I use that word a lot as well, in fact. But our station manager, Nick, he's started saying them now, and he blames me
right.
for getting him into that culture. But
well, everybody has their own ones that they use, and but often, if you hear one very often, it might catch on, and you find yourself using it. When I say that I think they're absolutely fine, what I mean is that they're fine to use them when you're trying to formulate what you want to say, or when you're having word-finding difficulties. They're not fine to use if you're using them to avoid blocks. So do you see what I mean? You can use these repetitions and prolongations and fillers in two different ways. You can use them as a stalling strategy because you still don't yet know what you want to say, or you can use them to avoid blocks even when you do know what you want to say. Okay, so there's some more here. An important thing in therapy, I think, is for each of us to identify the secondary symptoms that we use and to understand why we're using them and in what situations we're using them. And everybody's quite different. So even though in stammerers the central core tends to be the same, so the block is pretty much the same in everyone, the way they respond to that block or the way they get around with it with their secondary symptoms can be very different. And these secondary symptoms are symptoms that are learnt. They're learnt ways of getting around the block, basically. And because our learning experiences are quite different, then the symptoms end up being different too. So, yeah, when you have some spare time, it's good to consider, well, how did they develop? And why did they develop? And what role do they play now? And also, what might happen if I stopped using them or if I changed them? Okay, and there we are. Stop there.